subscribe now and press the bell icon. Never miss an update.
Namaste everyone. On behalf of Into Analytics, it gives me great pleasure to welcome you all for a panel discussion on the challenging times for senior citizens during COVID-19. Indoi, the ancient way in which Indians were referred to, the people of Indus Valley and civilization. Into Analytics is an endeavor to provide simplified information and analysis of issues pertaining to the citizens of India, an effort for India by Indians. We try to reach out to every citizen and provide unbiased and simplified information to enable them to take decisions and sides. In our journey, we have been blessed to have extremely knowledgeable and respected individuals contribute with their wisdom and thoughts on our platforms. Today, we present, again, let me reinforce, the challenging times for senior citizens during COVID-19. We are proud to welcome Padma Bhushan, Dr. Ambrish Mithal ji. Namaste, sir.
Thank you.
Professor Neeran Gautam. Namaste, sir. And Mr. Ashok Kumar. Let me give a brief introduction about our panelists. Dr. Ambrish Mithal is the chairman and head of endocrinology and practice department at Max Healthcare, a group of 16 hospitals. He was appointed the domain expert on the governing board of National Health Authority of India in 2019 and also the president of AIIMS, Gorakhpur. Dr. Mithal was the first DM in endocrinology from the All India Institute of Medical Sciences in 1987. He was the chairman endocrinology and diabetes division at Medanta Medcity for a decade before joining Max Healthcare Group. We are very proud to have you with us, sir.
Thank you.
He's been the recipient of various fellowships and awards from prestigious institutions both in India and abroad. He is the recipient of Padma Bhushan in 2015. He has received the IOF President's Award in the year 2016 and the BC Roy Award in 2017. His current research interests include vitamin D nutrition, primary hyperparathyroidism, osteoporosis, cardiovascular outcome trials in diabetes and NAFLD. We welcome you on board, sir. Professor Neeran Gautam, who is also the CEO of Indo Analytics. Professor Neeran Gautam is a professor of strategy and disaster management. He did his master's and doctorate in management from Netherlands. He also has master's in mass communication and journalism. He's been teaching for the last 20 years and been associated with India's top business schools like IIM and IMT. And he's also a respected faculty internationally also. He has worked in pharmaceutical, imaging and aviation industry for almost 20 years. He has presented various research papers in India and abroad, and he's been the recipient of exceptional leadership and international cooperation by National Leontech University of Taiwan in 2014. We are honored to have you with us, sir. Mr. Ashok Kumar. He's the director of Indo Analytics. He's a healthcare professional with 23 years experience in multinational pharma industry. And he has around 12 years experience in healthcare as vice president and director in various reputed hospitals like Kokilaben, Seven Hills, Global Group, and the Sagar Hospitals Group. He handles healthcare consulting with High Metrics Inc. as VP and also runs a US-India startup catering to healthcare needs of parents of NRIs called Health for Silvers. He's the MD of Healthcare 360 Degrees, apart from being the director in Indo Analytics. We welcome you on board, sir. And Ashok Kumar, sir, I'll leave it to you to carry the discussion forward.
You have to unmute. Can't hear you.
Bharti, you have to unmute Dr. Ambrish.
I have unmuted. So
That's
thank you,
fine.
Priya. Thank you for your kind words. And it's a real honor that I am with the most respected Dr. Ambrish Mithal, who has been, who was a wonderful friend apart from being a doctor during my daily days. A person of great eminence, and I could see that he will go to places, and I'm so glad that today he's a Padma Bhushan, and I'm sure it will only go up. And the service I keep hearing about you, sir, is fantastic. It's my honor to be with you, sir, really from the heart. Well, after my travels in pharma and healthcare, now I'm a startup guy, and it gives me a great pleasure to say that I'm involved in all senior care citizens, care of senior citizens. I'm involved as a strategy consultant, vice president for a Make in India first artificially intelligence-based handheld ECG. And it's my proud privilege because we are doing a lot of studies with my old friend, Dr. Srinath Reddy at PHFI. We are initiating something with my another old friend, Dr. Nikhil Tandon. We are working with Jayadeva at Bangalore along with Dr. Manjunath. We have worked with another old friend of mine, Dr. Prafulla Ketkar at KEM. We are working with Triple M. We are working with Sri Chitra. And we are proud that we are the first Make in India cardiac device, which is US FDA approved. I'll be contacting Dr. Ambrish Mithal very shortly, along with Dr. Mohan and others. We are going to start a pre-diabetes, this one along with NIMHANS as well as AIMS. The other one, which we have just about to launch, is Health for Silvers. Health for Silvers caters to the needs of senior citizens, all healthcare needs, right from emergency, that is ambulance on doctor on call. Also, definitely we have we are ensuring health insurance up to the age of 75. In the market, it is only up to 70. We are giving them regular health checkups with renowned institutes like Apollo Clinic, Lifespan Clinics, routine doctor checkups with various doctors across cities. We are operating, we will be operating in Delhi, Kolkata, Mumbai, Pune, Bangalore, Hyderabad, Chennai, and Madurai. And we are also giving home care through Portia. We are, of course, tied up with diagnostics. We are tied up with pharmacies like Apollo Pharmacy and MedLife. And especially in COVID conditions, we are now started with CardioScreen, Dr. Amrish, with a tele-ECG program, which we will discuss a little later. And this we are really proud because we are working, as you know, the ICMR guidelines of HCQ, hydroxychloroquine, as a prophylactic for the health workers. We have done a lot of work with the NGOs in the police force in Mumbai. And now we are just starting a very large program with Apollo, who are taken up OYO hotels as the treatment areas. And we are doing the pre-screening for all the health workers who are going to be on LCQ, as also all the patients who have any diabetes or hypertension or CVD. So with this background, I would only say that, of course, when we have an eminent man like Dr. Ambrish talking of diabetes or anything else is very, very foolish. And with this, I would only say, please, all of us, especially doctors, be safe, please take precautions. And even though I am now based in Bangalore, which is relatively better, things are getting worse everywhere. And I think we are getting used to the new normal. And I believe, before I go, since I'm working with technology companies, medical is going to be the new mobile, or to put it otherwise, mobile is going to be the new medical. And I'm sure and such people will agree with me that in healthcare and both in pharma, we are working with a lot of pharma industry now on hub and spokes and tele-ECG. We are working with about 60 NABH hospitals. Tele-ECG is now the norm. Telemedicine is going to be the norm. And we have to accept the new normal is going to be much, much different for healthcare as well as pharma in the new age post. I mean, I don't think there's anything called post-COVID. I think we'll have to live with it. Thank you so much, Bharat. Thank you so much, Rajesh. And of course, Professor Neeran. And looking forward to hearing from Dr. Ambrish Mithal. Thank you very much, Priya.
Thank you, Ashok ji.
So over to Professor Neeran. नीरन जी आपको अनम्यूट करना है.
Sir, Professor, you will have to unmute.
Sir, you have to unmute.
He's ready now.
All right. Hi, Dr. Ambrish. How are you?
Very good. Thank you. Thank you for having me here.
It's a great
It's
pleasure.
wonderful. Yes.
It's a great pleasure talking through mobile.
Uh,
Anyway, the idea generated, Ambrish, quite some time back, because I've been talking to many people around, in the society, when the old people, they gossip together in the morning and the late evening. They were very concerned about their own care. We have transformed from the social norms in a different, in a little weird manner. And they feel isolated, the senior citizens, perhaps. We both are now coming, but I'm talking about senior citizens who are still above us, 5-10 years, elder than us. Uh, One quick fire session, Amrish, with you before we get into the technicalities of the COVID-19 challenges. What is your take on the senior citizen? Are they assets or liabilities?
no, I think one of the things that happens with economic growth in any country, anywhere, is that the average age of people goes up because people live longer, right? So many chronic care conditions that we never used to see when I was a student or in earlier stages of my career, I'm seeing now. And the profile of disease changes as the demographics of the population changes, and
Yeah,
that is a natural sign of economic progress. So the truth is that there was a time when people were retired at 55 years of age. I remember that in UP, in Lucknow, the retirement age
yeah,
was
yeah,
55, then it became 58, then 60.
yeah,
Now, even now for professors, it's 65, otherwise it's all 60, 60. So quite clearly, most people in those ages are actually at the peak of their careers. They're actually, they have distilled all the knowledge they've acquired over the years and taken out wisdom from that. That wisdom is not available with the younger colleagues who may be very, very bright and very dynamic. But so I think there is no question that people who are above 65, 70, 75, depending on what they want to do, can significantly contribute to society in many ways. But I think the difference should really be about what they want to do. And we
yeah.
should not be expecting that everyone at 70 will be the same. Some may
Absolutely,
want to
absolutely.
work morning till evening. Some may say, I want to do 2 hours work. Some may say, I just want to do reading and writing. Don't want. So I think that option that the youth does not have should be available to senior citizens when they are crossing 65 or 70. And I think that's important. But to have that, health becomes primary. And of course, we have to make sure that they are healthy and we are healthy. Otherwise,
Ab-
there are challenges.
Absolutely, absolutely. What I gather is definitely they're referred as assets when it comes to wisdom,
Of course, of
because
course.
being intelligent is something different, but carrying a wisdom is something different.
Yes.
Uh, as a matter of fact, what I have been, discussing among the peer groups, Dr. Amrish, there is a curiosity among the seniors, the so-called elders of the society. Things are happening around because people keep telling them, look, it is so dangerous in this COVID conditions. Young may able to tolerate because of their, immunity levels. The elder generation supposed to be weaker in terms of the metabolism or, degenerative processes going along. So they have a fear in mind. They live in a little bit of fear psychosis. They confine, isolate themselves. Now, let us be very specific to diabetes, because every third or fourth person in India is diabetic today. You understand, maybe more than that, perhaps 2.5 or 2.25, something like that. Sometimes I find most of them, are hiding that they are diabetic, but perhaps they are more in numbers than the actual numbers. How do you see diabetes as a comorbidity in the senior citizens in the current COVID-19 conditions?
Yeah, I think that's an important question. It's also one of the few areas that's being researched the maximum in COVID. Although it's only a few months, you have a plethora of publications on that. And in fact, we are doing a symposium on that day after. But anyway, so the issue is that there is no confusion that people with diabetes and older people are more prone to complications of COVID. So we cannot deny that. How much are they prone to get the infection is not very clear. It's not so striking. But once they get it, the outcomes are poorer in people who have diabetes. We cannot deny that fact. However, we have a tendency to put all diabetes in one basket, which is not correct. Diabetes, which is well controlled, and people who are physically active, and they are taking their medicines, seeing their doctor, measuring their blood glucose, checking their 3-month averages. If they are well controlled, even at 75, the risk is not so high. It's a little bit more. But if they are people who've been chronically uncontrolled, haven't looked after themselves, have suffered some degree of vascular effects, in other organs, then obviously their risk will increase. So the key here is you can be a very fit diabetic at 75, or you can be an unhealthy diabetic at 65. So
Yeah.
a lot depends on how you manage your disease. Some of it is bad luck. It's not that you just, you can do everything. It depends on your luck also. Some people are more prone to complications. That's a different story. But by and large, diabetics who are looking after themselves are really fairly safe. And if you have already developed complications, which is possible, because if you're an elderly person, 75, 80, it's very likely some complications that have started. All it means is you have to be a little bit more cautious and protect yourself from infection. There is no need to panic. There are so many elderly patients we are admitting every day where I work now in Max, and they're getting discharged completely all right. It's not that every elderly person who gets COVID is suddenly, going downhill. That's not true. That's not true. And even with diabetes, most people, remember, overall cure rates of COVID are 96, 97%.
Wow.
So you have to, maybe it's a little lower in elderly, but still.
I understand.
So that's the thing we have to do.
Absolutely.
No need to be scared, careful, but not scared.
Yeah, because it is scary, as a matter of fact, because the media is playing its own role. They have their own TRP, so if it is scary, they make it very scary. You just now mentioned about managing the control of diabetes is very important. For a young person, taking the medicines regularly of its own, taking the pricks of his own, checking and noting the in Excel sheets the data, creating data, appears to be quite easy for those who are young, but especially those who are grown-ups, the elder. They require a lot of support system.
Yes.
There are so many vital requirements in terms of testing, pricking, noting, everything. What is your take? How the elders should manage? Because the younger generation, they have their own time limits, their own limitations. What is your suggestion to the elders?
I think I agree that it's a challenge. And I'm facing, since we have adopted telemedicine in a big way in the last couple of months, I'm facing this challenge. I'm facing this challenge, and many of our senior people, even people of our generation sometimes, are completely clueless about technology. They haven't grown up with it, and they are not used to a teleconsult or uploading their values and all that. They cannot do that. But I think technology will help, but it is not mandatory. I think it's if you can do the basics. For example, checking a blood glucose or taking your insulin doesn't require very high technology. Noting it down on a diary doesn't require high technology. Even if you can't do it, you have glucometers that will automatically record it. That also you can do. You have glucometers now which can send it on a server, central server. There are lots of things available. But even if you're doing good old conventional glucose testing, it is important to maintain a diary and write it. And people who are older are actually more meticulous about these things, and maintain a record and take a picture and just send it to your doctor or your nutritionist or whoever is looking after you. So recording, documentation is very important, and there are ways around technology as technology becomes easier, but there are simple ways which you could not have imagined even 10 years ago, which are so easily available to us now. So documentation, even by simple pen and pencil, it doesn't matter. Many of our patients come in the OPD just with that, but I'd much rather have that than have nothing and say, I haven't tested for last 3 months, So those things. The other thing is blood pressure checking also is important. And I think that's slightly more tricky because the machines are sort of, variable. But I think we have to now get used to the idea. COVID is teaching us everyone needs to have a BP instrument at home. And I'm sure you
Exactly.
guys are technology guys and management guys, you can tell better. But basically, we need easily operable BP instruments which are accurate enough for us to make some judgment.
Yeah, I do it every time I prick, I take my blood pressure, as a matter of
Exactly.
fact.
So, and then you have other technologies which are also very easy, Neeran, which elderly can use also. You have things you can patch onto the shoulder, which anyone in the family can do, and they can record your readings throughout. And the readings can be mailed by your son or brother or colleague or daughter or somebody to the doctor. So there are many ways around technology, and a little bit effort. You'll be surprised if people make a little bit effort. Some of them haven't used WhatsApp. I can't believe it, but some of them have not used it.
Absolutely.
But they learn in few minutes. It's just a
Yeah,
matter of applying your mind. Yeah,
even the elders have that potential to learn the technology
huge,
fast as
huge,
we do.
huge, huge, huge.
Absolutely. Another thing right now, which while discussing it came to my mind, uh, the more you grow older, your habits of eating habits, you see, sometime being diabetic, especially when we talk about diabetics, there are a lot of craving factors, that will come a little later. The eating habits and the style of the elders also take a lot of battering as they grow old, in terms of they're very, specific about eating the leafy food, the non-carb food when they are diabetic, especially more protein diet. Managing their food, of course, is also the responsibility on the shoulders of the
Family.
family. But very specific. Those who are living, uh, alone, or they are isolated, they are single elderly. I'm very specific, so that because you are there, you would be providing a lot of solutions. If they are living in a, they are single elders, I'm talking about. What do you think the role of nutrition and eating habits will impact their lifestyle, especially when it comes to diabetes?
So I think, Neeran, as you know very well, quite clearly, that is the key to success in managing diabetes. And I find that much easier to implement with older people than with younger people. Younger people think they are the cat's whiskers, kuch nahi hai, kuch nahi
हो
hota.
जाएगा.
हो जाएगा, देखा जाएगा. So I think older people are generally much more receptive, much more meticulous. They may have some idiosyncrasies. We all have. I have idiosyncrasies. You have idiosyncrasies.
Yeah.
But by and large, they are pretty receptive. And I don't think anyone should become obsessive about food. Obsessive about anything is going to be a problem for you and for your family. But following the basic principles and enjoying your food is exceedingly important. Food should not become a strain. It should not become that you're so careful that you can't enjoy anything. So it is important that you enjoy whatever you choices you make, and you have to be realistic. You have to be realistic. There will be times during COVID times, for example, when you will have to have some kind of bread. There will be times, there will be things when you cannot get exactly what you want. But the principles of diet are three or four, and I will quickly go through them without details. Number one, refined carbohydrates. Refined carbohydrates have to be reduced to the maximum. Refined means sugar, chini, or refined processed carbohydrates, safed bread, white bread, which I was talking about, naan.
Yeah.
Anything that looks white, polished white rice,
Mhm.
we should minimize that. We can't
Mhm.
take it away, but minimize as much as possible.
Right.
Add
Absolutely.
fiber. When we were younger, there used to be some fiber in the diet, which has completely gone with modernization and urbanization.
Yeah, it disappeared.
Choker in the atta was there, right? Choker,
Oh
there
yes,
was at least an
absolutely.
option. So all that is completely gone. So that fiber, adding, if you don't have anything, take a spoon of isabgol with every meal.
Oh,
If you can't get the right bread or something, at least add that fiber somewhere. I'm just saying.
good.
So that is fine. The first is refined carbs. Second is our propensity to we don't. I'll mention 1 second here again, that we don't look at hidden carbohydrates. We think chini chhod diya. We've given up sugar, but actually there is carbohydrate in everything. So as I said,
Everything.
refined,
Everything.
processed carbohydrate, biscuits. So we have nothing. Kya diet mein sugar is so high and we are struggling. Kyun बढ़ रहा hai? Diet is being followed, breakfast, lunch, dinner, ye wo, but morning tea, afternoon tea. But unfortunately, they are accompanied by 6 biscuits in the morning, another 6 or 7 biscuits in the evening, which are nothing, light biscuits. We have been taught all the wrong things. Biscuits are bad accompaniments for these things. So
Right.
reduction in that. obviously reduced fried food, and I think that most elderly people understand. They don't really go after fried food so much. uh, Third is, yes, protein. Of course, as you said, protein is important, and Indian vegetarian diets, it's a challenge sometimes to get protein in order. Sometimes you will find that it's very difficult to get protein, and if someone has milk allergy or dairy food, this thing, then you how do you get the protein in? One good
Absolutely.
source is soya bean. Soya products are one good source for vegetarians. Otherwise, it's predominantly dairy products. And of course, if you're allergic to milk, very often you can still take dahi. Don't forget dahi. It's the milk that has that bloating tendency and causes that all. But dahi is very good with probiotic. It's a good
Okay.
probiotic thing, right? So you can use dahi products. And of course, then you can consider, if you're not into any of those, then beans and dals and rajma, all those things are also rich sources of protein. This is the basis of diet, and we cannot get obsessive about diet, particularly in a situation like COVID.
Yeah, because elderlies, they have their own moods, their mood swings are much, volatile than compared to our mood swings. And they have the, they can dispense that kind of a mood. Their
Yes,
age, dictates the family.
yes.
One thing which is, again, which comes to my mind, I remember when 1990, you know my case very well. 1990, I had got diabetes and my all medical insurance plans got dismantled. They disappeared just like that. So cost becomes very important
Yes,
factor when it
yes,
comes to the elderlies with diabetes, and definitely if they are diabetic, there might be other symptoms also, cardiac issues and all. What is your take? How should they manage the cost of treatment? Because the cost of treatment is going beyond the controls.
yeah,
And
yeah, yeah.
recently,
Very true.
the insurance industry works very weirdly. The more you grow old, the premium also multiplies like anything. So their earnings becomes lessened, but their givings becomes very high. So what is your suggestion in terms of the insurance industry to work something for the elders, especially in the current conditions also? Because many insurance industries have come for a COVID insurance plan. So another
Yes,
premium is added to their basic
yes,
premium.
yeah.
So how to manage this?
So Neeran, you're absolutely right that there is increasing cost of healthcare, because now we are looking at quality healthcare. We're comparing with the West for the last 2 decades now. We talk of world-class care. It is not cheap. It is not cheap, and it is expensive. So there is increasing cost of healthcare. There is no doubt. And even if you go to government hospitals, the top government hospitals that provide the best care, if you actually did the economics of that, and you guys will be better than that than I am, you will find that actual cost per bed is very high even there. Just that the patient is not paying. It's your taxes that are paying indirectly. So people
Absolutely.
forget those numbers. People forget how hard it is. But that is one part. The truth is, unfortunately, our insurance system has lagged behind a little bit, especially in providing care for diabetes and chronic conditions. It is very strange, which my friends from other countries find hilarious when we discuss these issues, that you get paid, you can get your insurance for a coronary artery bypass claim, but you cannot get it for OPD diabetes management. If you had done the outpatient diabetes blood pressure management properly, you never probably possibly could have avoided the bypass.
Yeah,
So there
absolutely.
is a
Very
strange mix and
contradictions.
yes,
Yeah.
contradiction. So it's very important for us to start the process when we are young. I mean, of course, we can't go back, but it's important that at least for our children, that we get them insured very early, and then it's not a problem. If you get them insured early, systems work very well when they're healthy, and you get them insured in the beginning. And the same thing applies for managing your diabetes. If you manage your diabetes early stages very well, you're buying insurance. The first 5 to 10 years are the golden period for diabetes. Those who manage their numbers really well in the first 5 years, they can probably live a much more relaxed life after that. But in the first 5 to 10 years, people are young and they don't really care. They're
Yeah.
not feeling anything. And by the time they start caring, they've already got some organ affected or the others. That is normal process. For those who
Right.
have reached that stage, I suppose most people should have had insurance. But I do agree that it'll be tough to buy insurance for someone who's 70 plus in the society these days. I don't know if there are new schemes, but I know that it used to be very, very difficult to buy any
No,
insurance.
I mean, 70, 75, they don't offer any insurance, as a matter of fact, most of the companies. But there are few companies who have started, providing you medical insurance if you have, spent, say, 4 or 5 years of the previous illness. You pay premium for 1 year, nothing is there, then there are certain companies which are doing it.
Okay.
Now, coming to another very important
Sorry
issue.
to interrupt, just because I am from that industry and I'm working with
Sure.
insurance companies in my Health for Silvers. Now, yes, we have special schemes. For example, Health for Silvers is tied up with Star Health, and the insurance is up to 75. And I can tell you, I am myself on a 30 lakh insurance, and I'm not paying too high. I'm paying 72. I think, coming to your point, I'm a diabetic, I'm a hypertensive. But if you're with an insurance company, the latest government rules also say that predisposing this one's illness, you cannot take it if you're insurance for 6 years and above. And as you rightly said, this is going to be helpful. The younger you start, the less premiums you pay. So insurance is evolving. It's an evolving industry, and I can say that the insurance is available with certain factors up to 75. Sorry for coming in.
Yeah, it's okay. It's absolutely. Thank you, Ashokji. So, Ambrish, I was coming to another very important issue, like many other drugs which are sold over the counters, which are OTC products. Still, a lot has to be done. Ambrish, I am unable to see. There you are. So OTC has become, they are spoilers basically. They are treatment spoilers. And yesterday only someone asked me from Lucknow, a friend's wife got diabetes a couple of years back, and she was asking, Bhaiya, can you give me the best oral hypoglycemic which I should take? I said, I cannot offer you any name or any brand. You have to contact your diabetologist. You have to contact your endocrinologist, because a lot of things are required to put a one single drug on the prescription. Don't you think it is time now for the Ministry of Health to scrap away these issues? Even the hypoglycemic should not be sold absolutely without the prescription of a medical person, because they are very dangerous. You never know. Hypoglycemia, I've seen it. You must know it. What is your take?
I think, Neeran, the government is thinking exactly like you do. And actually, technically speaking, legally speaking, they can't be OTC. The problem is that in the moment you move away from the metros and move towards the periphery, everything is OTC. That is a challenge. Even steroids are OTC. Dexamethasone is OTC. So I think the government has become stricter and stricter, and patients keep complaining. ये अभी तो पर्चा भी चाहिए सर, अभी तो वो भी खत्म हो गया, वो हार्ड कॉपी भी मांगता है केमिस्ट, फोटो लेके रखता है. They do all those things in bigger cities because they can be accountable. So I think it is happening. But the habit that Indians have of asking their uncle or mama or chacha what medicine he was taking and why, every day, every single day, today also, someone asked me, but my neighbor takes this, why are you giving me this? So, Minika, if there was just one medicine for diabetes, I would make a...
yes, yeah, he's there.
Or, okay, Ambrish, I continue with my the earlier question. I don't see you on the board. Priya, could you please make
I see myself.
Ambrish available? Oh yeah, now there you are.
We all can see him, don't worry.
The feeling of seeing is very important, that generates a lot of the what you call the steroids in the body. All right. Okay. Ambrish, like last time when I was talking to you, the market is rife about technologies, the services. You can do this, you can do that. Why don't you come to me? We are selling this. So many things have come, new technologies have come. I told you about some button, that would be there for a week or so. Like you also said that you can, plant certain measures, sensors, equipments, so that your blood pressures could be measured. Similarly, there are instruments where your sugar values are also without prick being, taken through certain measures, devices. is it, the market is rife for full of such information. What do you suggest? What is the best thing to do? Are the Indian markets ready with these kind of devices, instruments? Because Ashok will tell about the devices little later when I talk to him. What is your suggestions? Should we listen to these things, or the conventional and traditional methods are better to look into it?
So I think this area has been one of the major areas of growth worldwide. And remote sensing, or whichever way you call it, whether it's for blood glucose, whether it's for blood pressure, whether it's for ECG, Dr. Kumar was talking about tele ECG and all that. I mean, that clearly is the future. There is no question about that. There is no question that your data, you should not have to go to your doctor just to share your data.
That's true.
Only if you have a problem. And you should not, and even for that, even for the doctor, the data should be in a form which is easily comprehensible, and he can get the gist out of it and use AI and other things. So what is happening here, this is very much happening around us. Now, we have to just wait for each of these to reach the stage of fruition, which means completion, which means approval by the required bodies. Only then can we start getting, using them actually. But as that is happening step by step, more and more such things will enter the market. COVID has accelerated that. COVID has accelerated because doctors are now asking for it all the time. Earlier it was patients and doctors somewhat, but now doctors are saying, yeah, I need more information. How the hell do I deal with this? How do I treat my, if someone's having BP fluctuations at home, it's a big challenge. He cannot come. What should I do? So COVID has accelerated that process, but it was already on. It was definitely one of the hot areas, non-invasive glucose testing. I'm involved in some project. There are amazing things that are happening which will change the way. Even this little Libre thing, which is being used so commonly now, and all kinds of new devices to monitor blood glucose is becoming easier and more accurate, and actually even cheaper. The price is coming down. As it becomes popular, price will come down. So I think technology is very much here to stay. We should use technology to help us and not become slaves of technology. That's another angle. Some people just get stuck in that technology and they forget what the larger picture is. So I think I'm all for it. I think digital technology will impact chronic care of diabetes, blood pressure, heart disease, etc. in a big way. It already is, but it will do. The other thing you have to realize is that not everyone, we think India is a big market, there are so many people, everyone should. Actually, the number of people who want to adopt technology is very small. Huh? The number of people who will initially be forthcoming about technology is very small. And very only when it becomes easier and easier, like the world did with mobile phone, like the world did with railway reservations, like you do. So when it becomes, only then will people adopt it. The easier it is for people, the easier they will adopt it. Now you have to build various mechanisms into that. You have to build an interface. You have to make sure that there is someone, there's a team that deals with it. For example, for many things, you don't need a doctor in diabetes. Not just a patient, you need a in-between person, a diabetes educator, or someone trained. Even an ANM who is properly trained. Even I know in UP, they are doing huge amount of projects. Our friend Piyush Gupta is involved in that, where they look doctors in cities in the government system. Oh. Yeah. So all this is happening. So I think you can train these people to be the interface. You can have more. You can spend less on recruiting doctors, more on recruiting ancillary staff. So, for example, if I'm managing an insulin-dependent diabetic now, I have a large team, of course. But what I'm saying is that each one of them is attached to one of my educators. Absolutely. And I only get a feedback if there is a problem. Otherwise, a pregnant diabetic. So at least the high-profile areas, we've tried to do that. So I think it's a huge and important area.
So, Dr. Ambrish Mithal, one statement that how many devices do you think are currently in the market which can be used?
No, I mean, I can't give you a count, but yes, of course, there are lots of glucometer type of devices. There's no question.
There are many glucometers.
And then
now
there are
you can attach your glucometers with your mobile also.
Exactly, that you can do even without attaching through Bluetooth. It can go to your mobile. It can go to a central server. It can, if your doctor permits, it can go to them directly also. Okay, you can do that. You have continuous monitoring devices. Again, there is a possibility people already have developed apps for the patient to see all the time what the blood glucose is.
Absolutely.
So there are huge number of such devices. Just two examples, but there are lots on the way. And as they keep getting approved, then we will have a plethora of devices available to us.
I would like to share one thing, like, these medical companies, Ashok ji is also there. The pharma companies, they contact the doctors. I would also suggest, because they would come to you for diabetic treatment as a diabetologist, as a endocrinologist. A suggestion to these pharma companies, if they could, on a society level, they can bring these diabetics on one platform. In Ghana, they have started doing it. They bring at least 100, 200, diabetics to a platform where these pharma companies talk about the products along with a team of professional doctors. So 1:1 over there, and then followed by clinics. We do not have this kind of a system.
Actually, Neeran, we do.
There is a problem in pharma companies in that. The compliance does not allow any pharma company to directly contact a patient. And this compliance is worldwide. I'm sure Dr. Ambrish Mithal will agree. It's very important to understand this.
So I think you cannot directly approach patients. That is absolutely correct. But the truth is that pharma companies have been involved in patient education in many, many ways. So even they do help. Supposing I want to organize a meeting of 100 of my patients, there will be people willing to support. What support? Make the phone calls. Make sure that there's no big financial support in all this. But they will. And they're not advertising. They're probably doing it as CSR or something like that. So
Absolutely.
Pharma companies don't. They have been quite involved. Insulin companies have been hugely involved in early initiation of insulin. They're working with government in Bihar, in Tamil Nadu, in so many places. There are huge initiatives. So there is involvement of industry. Yes, it should be more structured. And it can be more
because Ambrish, what I feel, because I've worked in the advertisement industry as well, most of the pharma companies, when they give advertisement, it is not only for doctors. Every patient, every person, every particular individual citizen, they go through the advertisements. That is also a contact, basically. A communication is a contact. So the compliance need to be, adjusted accordingly. This community awareness I'm talking about, not the treatment. I was focusing on community awareness by the pharma companies. So that was the point which Ashok ji has answered. And now one final, both Ashok ji and Dr. Ambrish, how long do you think that diabetes still need to suffer in terms of bringing the best technologies and devices to Indian diabetes patients?
So, Neeran, the truth is that if you look actually at what is available as devices in India, except for the ones developed maybe in 2019, I think almost everything is available in India. So as far as availability of technology goes, those days are over when we had to wait many, many years. Still, there are little things, very expensive things which are not available here because there'll be no market for them. But overall, I would say we are not hampered. We can't say because we are in India, we don't have that technology and that's why we can't serve our patient well. That's not the case anymore. We lag behind by a year, sometimes not even that much. And many times Indians with their innate tendency to modify and jugaad, they can actually use foreign technology in a cheaper way and modify it and make it even easier for Indian patients. So I don't think, Neeran, this was the case when you and I were young, that technology was so much behind the West, but not anymore.
Yeah, because I know certain instruments which are used in as a glucometer, they require validation over a period of time. But the companies, they like to sell their new products rather than validation. So validation versus promotion is a big one. We'll talk something at a different level and not the appropriate time right now. Now we are towards the conclusion of our session, Ambrish. It was so nice you to be there, and I must tell everyone that apart from being a wonderful doctor, you are a wonderful person as well. Not that we have spent good many years together. Now, a final statement that has to be a nail in the coffin for the senior citizen as a diabetologist during COVID times. One final statement from Dr. Ambrish.
Well, I think we need not be scared of COVID. We have to take precautions, but no panic. If we are generally looking after our health, we are fairly well protected from COVID. And of course, in the social distancing and masking, which I think somehow Indians don't understand masking. I can't understand that problem. And really, social distancing and masking, hand hygiene, just the three things will keep most of us safe. And they apply to youngsters. The precautions are same for youngsters, because there will be a youngster who comes to your house, who your son or your grandson or somebody who's living with you, he also has to observe those precautions. He can carry the bug for you. So my thing is, stick to the basics. Just the basics means wear a mask when you go out. Make sure you're a senior person. Make sure everyone wears a mask in your colony. Make sure that people are not and not standing close, standing 2 meters away or 6 feet away, and making sure that we wash our hands as many times as we touch anything at all. That's all we have to do. And rest, some things are beyond human control for everybody, including doctors.
Absolutely, absolutely.
I have one point, Ambrish and Prof. Gautam. With all this, you can edit it if you want. The best thing what has happened about COVID is the fraternity, which was, sorry to use the word, highly abused. The doctor community today is now treated as gods. And I am, because I've seen this community from both the very close quarters for now more than 3 decades. I'm so glad that everybody is saluting doctors. I'm very, very glad. And just one point, what Dr. Ambrish was saying is that COVID actually has reduced 10 years of telemedicine in 10 days. We have really taken off like rightly pointed out by Dr. Ambrish, from iPod to iPhone took a long time. But now from clinic to telemedicine has taken, because of COVID, these are two positive things I look at COVID as. And I'm very glad about both of the things.
Because telemedicine is both eco-friendly and environment-friendly, basically, as a matter of fact, in the larger terms. So thank you, Ashok ji. And once again, thank you, Dr. Ambrish. It was wonderful to be together. And I'm sure this particular event will carry the meaning to the people who are concerned for the benefits of the elders of our society.
Thank you, Neeran.
Over to you, Priya.
I'll be sending you a message requesting your email ID. We are working on some things. I would like to share that with you.
Sure.
Thank you once again, sir. Thank you so much, Dr. Ambrish, and thank you for saying such reassuring words to the patients that they need to stay safe and they can stay healthy provided they follow social distancing norms and cleanliness, basically. Thank you so much, Professor Neeran Gautam ji, because you asked questions from a patient's perspective, which was very helpful, brothers. And thanks a lot, Ashok Kumar ji, from joining the panel and telling us things on the medical technological point of view, the patient's stand. Thank you, all the three of you, for giving us your valuable time. Thanks to all the viewers for keeping up with us.
And thanks to you, Priya, for bringing us together on a platform. And also thanks to Bharat for making this event possible.
Thanks a lot to Neeran.
Have a very good evening.
Thank you.
Bye.
Subscribe now and press the bell icon. Never miss an update.